Welcome to Crisis in Perception, where we examine the systems shaping our world.
Okay, so just to be clear, what we're doing here is a compressed structural companion to the deep dive. It's not a summary, and it's certainly not advice. Think of this as a blueprint, a way to understand the system of global food fortification from the inside out.
All right, so here's our game plan. We're going to follow a really clear path. First, we'll map out the system itself. Then we'll dig into what drives it, the incentives. After that, we'll look at the results, use a powerful metaphor to make sense of it all, figure out why this system is so persistent, and finally, connect all the dots back to global governance. Let's jump in. All right, first things first, the global fortification system. So, who are the key players here? Who's actually running the show when it comes to adding micronutrients to our food on a global scale? And wow, just look at this. It's a real web of influence, isn't it? You've got the big UN agencies like the WHO and UNICEF. You've got private philanthropy from groups like the Bill and Melinda Gates Foundation. And then you have industry groups and public-private partnerships. They're all in this mix, all interacting and shaping global policy. So right at the center of this whole system, you'll find something called public-private partnerships, or PPPs for short. And these are absolutely crucial. The WHO even calls them the primary arrangements that influence global food fortification governance. They're basically collaborations that bring together the public sector, think UN agencies, and the private sector, like corporations, to hit specific health goals. Okay, so now we know who the players are, but the really interesting question is why? What makes this whole system tick? What are the incentives that are driving policy and making fortification the go-to solution? Well, if you're a policymaker, the logic is pretty compelling. I mean, think about it. Fortification looks like a super efficient way to reach huge populations at scale. It makes global trade and regulation way simpler. You can easily measure the results with things like biomarkers, and maybe most importantly, it offers a neat, tidy, technical fix for what is otherwise a really messy problem.
But here's the kicker. This preference for a technical fix goes deeper. As Mark Lawrence points out in this quote, there's been a real shift. We've kind of moved away from focusing on social and community development and are leaning into this more medicalized approach. The argument becomes that you just can't get all your nutrients from diet alone. So we end up treating the symptom, not the underlying cause.
So, what happens when you put these actors and these incentives together? Well, you get some very predictable outcomes and debates. And you can see the results of this system pretty much everywhere. I mean, this has led to some absolutely massive public health campaigns. We're talking about things like widespread salt iodization, mandatory flour fortification with folic acid, adding vitamin D to milk. All of this is guided by these standardized global guidelines. And this right here gets us to the heart of the ethical debate. It's a classic tension, really. On one side, you have the common good argument. Let's prevent widespread nutrient deficiencies for the entire population. But on the other side, you have individual autonomy, the right for each of us to choose what we put in our bodies and to say no to mandatory interventions. Okay, so to really grasp how this system works and its limitations, let's use a metaphor. It's a new way to see the whole thing, and I think it's pretty powerful. Here it is. Fortification policy is like installing corrective lenses into the food system. Think about it. The lenses adjust for deficiencies on a massive scale, but they don't do anything to redesign the underlying structure that caused the poor vision to begin with. So that begs the question, right? If it's just a set of corrective lenses, why does this system persist? What's the power of this path dependence? Well, for one, it just fits. It aligns perfectly with global trade systems. It's totally compatible with industrial food production. Plus, it produces these nice, measurable outcomes that you can put in a report. And all of this leads to what's called institutional path dependence. The system just gets locked in, and it becomes the way we do things, making it super hard to change. And this is where we get that crisis in perception. You see, when you frame the problem as a lack of synthetic folic acid, you've already constrained the solution, right? The only possible answer is to add that nutrient back in. And in doing that, you completely crowd out other conversations, like why were people's diets missing folate in the first place?
All right, let's zoom out now. For our last piece, let's see the bigger picture and connect this system to broader trends in global governance.
So the real question is, how does this specific system of food governance reflect these bigger trends in development policy and political economy? What does it teach us about how we approach global problems as a whole? And that's the key takeaway. When you understand the whole system, the actors, the incentives, the path dependence, you get this incredible structural clarity. You start to see why technical solutions so often win out over deeper systemic reform. It's not by accident, it's by design.
And that's an insight that goes way beyond just food.
Crisis in Perception examines how systems shape belief and how better tools help us see clearly.
This project is free and publicly accessible. If you'd like to support the time, tools, and research behind Crisis in Perception, you can become a supporter on Patreon.
For a longer audio-based analysis of this topic, see the deep dive linked in the description.
If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.